Hello, my name is Arun Radhakrishnan, and I'm a 2017 AMS Phoenix Fellow. I'm also a family physician with a focused practice in chronic pain working in Ottawa, and the clinical lead for the collaborative mentoring networks at the Ontario College of Family Physicians. The title for my AMS Phoenix Fellowship is Leveraging Large-Scale Mentorship Networks to Support Compassion in the Primary Care Setting. It's been a privilege to be supported by the AMS and the Ontario College of Family Physicians to pursue this work, and I've also had the luxury of working with not one, but three mentors that include Doctors Sarah Newbury, David Wilger, and Sophie Soklarides. For my work, I've chosen to focus on the collaborative mentoring networks as an example of a large-scale mentorship program. The CMN has been in operation for over 15 years and has been supporting family physicians by connecting them with regional experts in the areas of addictions, chronic pain, and mental health. These experts provide timely knowledge and clinical support to family physicians to help build their competency, their knowledge, their confidence, their safety, and their security in navigating some of the challenges that are seen in mental health addictions and chronic pain. I've been a part of this program for the last 10 years, starting as a mentee, evolving into a mentor, and more recently, the clinical lead. My first-hand experiences in these programs have shown me the incredible value of mentorship in being able to support a focus of compassion in how we interact and deal with our patients in the areas of mental health addictions and chronic pain. To describe some of the work that I've been doing over the last year, I can break it down into two key areas. The first is understanding how mentorship networks are able to support elements of compassion, and also understanding how we can better support and strengthen that within the CMN networks. The second area of my work looks at developing collaboration with health system partners with an eye towards ensuring that CPD programs and tools have an emphasis on compassion, particularly in the areas related to the opioid crisis. With the funding from the fellowship, I've been able to engage in an explorative qualitative study that's been done in collaboration with Dr. Soklarides at the Center for Addiction and Mental Health to understand better how mentorship exactly is able to support a focus on compassion. Through this work, we've begun to understand that the subconstructs of motivation, sensitivity, navigating empathy and sympathy, distress tolerance, and engaging with patients in a non-judgmental fashion are all areas that mentorship is able to support, and as a product of that, enable our clinicians to better focus on compassion. The second component of my work within the CMN program has focused on articulating and expanding a focus on compassion. And towards that end, in the last year, I've worked with the clinical leadership to embed the notions and ideas of compassion into the values and the goals of the mentorship networks. Additionally, we've ensured that the CPD programs, such as conferences and regional meetings, all weave in themes of compassion, again, to bring the attention of clinicians across the province to the value of compassion. And lastly, I've also had an opportunity to work with clinical leadership, some of whom include AMS Phoenix Fellows, to engage and support discussions around compassion within the mentorship discussions that are taking place. The second area of work that I focused on is on collaborations external to the mentorship networks. And in that context, I've had an opportunity over the last year with support from the fellowship to work at the Ontario Pain Management Resources Table to support the opioid strategy from the provincial ministry. This work has allowed me the opportunity to collaborate with a variety of organizations such as Health Quality Ontario, the Centre for Effective Practice, Continuing Professional Development Ontario, and the Centre for Addiction and Mental Health, to name a few. This opportunity has allowed us to ensure that the programs and the CPD tools that are being created all have embedded in them and woven into them the ideas of compassion. And this is particularly important in the context of the opioid crisis that we're facing, to ensure that we remain compassionate with the patients that we're engaging with. For my last part of my work, what I'm hoping to do, inspired by these stories, is to further that dialogue amongst providers to better understand what are the barriers that they're facing and how can we overcome those barriers to ensure that as we're working with patients who are in the midst of this crisis, that compassion is at the heart of how we engage with them.